Yeah, so I'm going to cover basically two opportunities for training at Oxford. One is the summer school that we run every year. If you go to the next slide, please. This is essentially a one-week residential in one of the beautiful Oxford colleges with morning lectures followed by afternoon practical sessions. We divide people into, well, let's self-divide people into two tracks: the people who prefer to be working more on study design, interpretation, and the likes, and people who really want to program and want to be hands-on running practical sessions. And all our training is based on generation of real-world evidence using OMOP and using OHDSI and Darwin EU tools and packages, all using OMOP data. If you want to go to the next slide, please. Just to illustrate a bit the agenda from last year, we do cover the essentials of real-world evidence, real-world data, study designs, descriptive analysis, a bit of work on confounding, a bit of work on phenotyping, drug utilization, characterization studies, and a little bit of an introduction into health economics. And if you go to the next slide, some of the highlights of the training are the fun activities that we organize in the evening. So to the left, you can see people trying to punt in the River Cherwell. This is probably the least efficient way to move that has ever been invented by human beings, where you have this pole that you need to use to move your boat around. We had all these students trying that and nobody fell in the water, so that was a success, I think. And then to the right, you can see a picture of one of our practicals last year where Albert Prats was explaining to the whole team how we design studies and how we implement phenotypes. So that's quite a hands-on group kind of exercise that we do every afternoon during the week. And then very importantly, for the last 3-4 years, we've managed to get funding to run these Trueta bursaries. Professor Trueta was a war surgeon who left Spain after the Civil War and then became an academic surgeon in Oxford for like 20 years. And we have 3 places with full residential scholarship, including boarding and food and everything. And the eligibility is there. It's essentially targeted to people who are refugees, stateless people, or asylum seekers, people who reside in a low or middle income country, people from a low income background in the UK, and any MSc or PhD students from a relevant program all over the world. We love to read all the people's applications, and we love to meet these people when they come over. This year we had colleagues from Africa and from Latin America, the 3 people that you see there. It's a really good opportunity, I think, for training. And then finally, my last slide is our PhD program in clinical epidemiology and medical statistics that we run in our health data sciences team in Oxford, fully based on OMOP-based real-world evidence generation, research on methods, and some clinical questions. It's a 3.5 to 4 year program typically, unless you do it part-time, and we are currently open for applications. You have a QR code there that takes you straight to the projects that have been advertised. And as we mentioned earlier, we do have a fully funded scholarship already on the name of Jamie Weaver, where we will continue work that had been started on outcome-based classification and how that impacts our studies and how to minimize that impact. So yeah, we're really looking forward to lots of applications from the OHDSI community to honor Jamie's legacy and continue his work.